Hello, everybody. I'm very glad to be with you today in this very important gathering. Important because you are going to speak to fight for the right to health in general, but for people living with HIV/AIDS in particular. And this is an important fight. I know you are very young, some of you are students, some of you are like me in the fight since years, and some others are even in the fight before us. But we are all together here. We came for what we call social justice and right to health. It's very important because even if we have made a lot of progress, a lot remains to be done. If I remember when I came back in my country, in Rwanda, late 90s, it was not a good pictures I found there. People were dying every day for a disease that have a treatment somewhere else in the world. IVs were existing in the north, in the west, but for us it was totally not accessible. Up to the time, some people like you at that time, young people, stood up and said no. I remember the people you are fundraising for today, Partner in Health, funded by Paul Farmer and Jim King. Both of them stood up and helped the world to create Global Fund and after that PEPFAR. These have changed dramatically what was my life as doctor at that time in Kigali. People were no longer dying. We have managed to build a health system, a platform that was not only for people living with HIV/AIDS, because we have built health centers, we have equipped pharmacies, we have equipped lab, we have trained lab technicians. Those people are not only working for people living with HIV/AIDS, TB or malaria. When they have a microscope, it serves all diseases. When you have a system for procurement drugs, timely and targeting quality drugs, it serves all the diseases. When you equip an antenatal clinic for providing women with tests, with good counseling, with good nutrition feeding choice, when you equip a maternity for good delivery, safe delivery, it serves all women in Rwanda. In one word, the money for HIV, tuberculosis and malaria have really strengthened the health system. And this is the principle of sustainability, because what you build serves all. Of course, in priority it serves people living with HIV/AIDS, but it serves all the nation where the people are living in the health center at sector level in the community, and it allows us to serve people living with HIV/AIDS and the entire country. We build that taking 4 principles in account: equity, participation, science, and accountability. All this to reach sustainability. I'm going to explain you why. Equity, because we don't want to left anyone out of benefit. In Rwanda, nobody can stand up today and say, I'm HIV positive, I need treatment, I can get it. This is for our people or anyone living in Rwanda, in the Rwanda territory. Participation, because we have respected the principle, we don't do anything for a group, whatever group is, without their participation and their view. We have also the science, because we have to adapt what we do with the knowledge of the day. Things have changed. Remember, late 90s, when we started providing treatment in Rwanda, and today things have changed. The follow-up of patients, the capacity of we can give to the lab to provide timely diagnosis for early child diagnosis. All those things have changed. We adapt. We have strengthened the entire health sector, from the community to the referral system. We have 45,000 community health workers. We have equipped them with a phone to call for help when somebody is in need or to alert about an outbreak, and this with HIV money. At the upper level, we have strength health centers and hospitals, equip them in the lab, in the pharmacy, in the antenatal clinic, and also in the maternity. Also, we have created emergency room to be more able to welcome people in danger. And we have also, at the referral level, educate specialists to care about complicated case and side effect of the disease or side effect of the drug. So the entire health system is strength, but not only for people living with HIV/AIDS. It serves the entire population of Rwanda. And sustainability, we have to do that because health, we take it as a piece of our development. So we have adapted that to the fight against HIV in Rwanda, using the global solidarity we have benefit from the fight of people like you. And I urge you all of you, to continue the fight, because there is a big risk out there. If during the last 15 years, money has flowed up to support the fight against HIV/AIDS, there is high risk now that this slow down. There is a high risk that the half of the people who need ARVs in the world now will never get it if we don't continue the fight with the same energy. And young people, we count on your energy. We count on you to spend sleepless nights fighting and assure that those people have also the chance to get this life-saving treatment, to get timely diagnosis, to have access to infrastructure that will help them to remain healthy when they're HIV positive, but also in their community, bringing health as a whole to all the people they live with. I will also tell you that never forget some principle. The principle of when you go to help friends across the world in this fight, always go as a partner. Don't come and dictate. Always respect the ownership of the people. And for the people you come and support, for them to exercise the ownership fully, transfer capacity, transfer knowledge. Always give the best of what you have. And if it's hard, never forget you are not alone. We are a big family, the global health fighters, and you are the next generation, the coming leaders, politicians, clinicians, that will make the world better tomorrow than what the world is today. So I wish all of you a very productive year, coming year, but also all the years that are in front of us. Use all your knowledge, all your energy to change the world during that time. Thank you.